afternoon, good evening, happy holidays, happy Thanksgiving in advance. I am Dr. Brianna D'Souza with the Department of Dermatology at Wake Forest School of Medicine in North Carolina. It is a pleasure to be here with you all. Thank you to Dr. K and Lakeisha for asking me to participate this evening. I am not able to be with you guys live because I am traveling home for the holidays. But I hope you guys enjoy this educational session. And if you have any questions, comments, or concerns, please relay that to Lakeisha, who hopefully can relay that information to myself. Let's get started. A few housekeeping issues. So one, you might see me looking off to the side just because I want to make sure that I stay on topic for tonight's presentation. So I might need to refer to my notes every now and again. And the other thing I will say is that tonight, all of these comments, everything that I'm speaking on today are my own thoughts, opinions, and commentary, and not a representation of Wake Forest School of Medicine or Wake Forest Baptist Health. All right, let's get to the good stuff. So the first topic we're going to be talking about is skincare and research. And so that is one of many hot items in dermatology right now, specifically focusing on diet, dietary supplements, and the interplay between nutrition and the skin/gut microbiome. So what is a microbiome? So a microbiome is a fancy name for basically the environment, the collective environment in our skin and gut that is made up of fungi, bacteria, protozoa, viruses that contribute to metabolism, immune response, preventing infection, all kinds of things. And so the interest is because we've long known that a lot of dermatologic or skin conditions can be related to issues in the gut and or issues in the skin. For eczema, for example, there is a breakdown of the skin so that it's not able to keep moisture in the same way that non-eczema patients are able to do so. And that's just one particular skin condition, but there's a whole host of them that can be affected by the particular imbalances, we'll say, within the microbiome system. Again, of either the skin or the gut or both. And so there's a lot of research into prebiotics and probiotic use among eczema patients to see if that can potentially help their disease or change their disease in some way, maybe prevent the extent to which they get flares, the severity of their disease, etc. And I think along those same lines, we're looking at acne patients and seeing, if certain foods and dietary supplements can influence that particular group of patients as well. Lastly, I'll say there's a new push to kind of look into honey and its multiple properties in inflammation and skin and wound healing, particularly in skin conditions. So more to come on that. The next topic, skincare myths. So there's quite a few. I should, journal all of the different ones that I hear every day, but I don't. So I'll just try and remember some of the few that come to mind. So one is acne and nutrition. So oftentimes mothers will come in, fathers will come in and say, Doc, my son or my daughter eats awfully, and that's why their acne is as bad as it is. So there have been a few different publications speaking to excessive dairy intake or obesity or high sugar content in one's diet as contributing to acne, but none of that has been conclusive. So we want to be really careful about what we're telling our teens and young adults that have acne. There is nothing to indicate that nutrition or diet plays a role in it. That we can say at this present time. That being said, we within the medical community always encourage healthy eating, a balanced diet, etc. for overall health. because even though it might not exacerbate one's acne, it can definitely contribute to other medical diseases such as high blood pressure, high cholesterol, diabetes, etc., which may predispose you to other skin conditions, and or if you were to develop other skin conditions, make them much worse, such as psoriasis, hidradenitis suppurativa, just to name a few. So we want to just make sure that overall we're taking care of our health. So that's always a good idea. Another skincare myth that I hear from a good number of patients is this huge push for dietary supplements. I feel like we all see it anytime we go in a grocery store, Target, wherever we're going. You're going to see some supplements promising better skin, better hair, better nails, all of the above. And if it's not in the supermarket, then it's definitely on your Instagram feed in some capacity. And so I think it's really critical for me as a medical provider to say unequivocally that unless you have some sort of deficiency in a particular vitamin, then you don't necessarily need to be supplementing. I think if you're eating a well-balanced diet, and if you're exercising and if you're at your happy ideal weight, that's what matters. And your body should be able to have healthy glowing skin, healthy nails, healthy hair, all on its own. I think that by and large with the biotin supplements particularly, a lot of people have been purchasing those, including my own family members. So my family is not immune, but I think by and large, unless you have a biotin deficiency, which is quite rare, you do not need to be supplementing with biotin. Additionally, I think that the research has shown that biotin supplements are not helpful with hair regrowth. They can be somewhat helpful for nail regrowth and nail strength, but not for hair regrowth or hair strength. Additionally, I'll say that sometimes with these supplements, they aren't without harm. Particularly with biotin supplements, there has been quite a bit in the medical literature speaking to the fact that biotin supplements can alter other lab values, including thyroid testing and cardiac markers that we would use for patients that come to the emergency room for a heart attack, to screen for a heart attack. So if you're taking biotin supplements and none of your providers are aware of that, and you're given a regular screen for thyroid disease, it could come back as positive for thyroid disease. Although you don't really have thyroid disease, it's because the biotin supplement that you're taking is affecting the test in such a way that it makes it look like you have thyroid disease, which we don't want because that's another pill or another medication you would have to take for a disease that you don't really have, that can also come with a lot of negative side effects. In addition, there have been reported cases of patients presenting to the hospital on biotin supplementation who have had elevated cardiac markers, indicating that they may be having some sort of heart attack or heart issue when they're really not, because again, the biotin supplement can affect other lab values in regular screening. So again, just things to keep in the back of your mind. These supplements do not come without their own potential risks. And if it's not doing you any harm, I think we can all agree that saving one's money and not buying it is a much better investment in our overall health and wellness. So biotin supplements, unless you actually have a true biotin deficiency, not something that I'm going to recommend. Same goes for other hair, skin, and nail vitamin supplements over the counters, and a lot of the other products, collagen, etc., all these new crazes that people are coming up with to try. Not always going to recommend them, just given the fact that we need to do more research to see what potential harm can come from taking them. So those are my 2 cents on that. Those are my skincare myths. Okay, next topic is about food, especially as we're entering the Thanksgiving holiday season, food and skincare. So, kind of like what we were talking about with acne, there haven't been clear indications with all skin diseases saying we need to stay away from this or stay away from that. But I think the large body of evidence indicates that you want to make sure that you're avoiding foods that have a high sugar content, that you want to avoid things that are high in fats, and that as much as you can, minimize those things along with alcohol use or excessive alcohol intake. All of that will be healthy for you long term because it's not going to have the kind of inflammatory impact that one would expect from those types of products and using those long term. So again, I'm not going to say to not have fun on Thanksgiving, to not have a beverage or two, to not have, a little extra piece of ham or turkey or whatever your pleasure is, but just everything in moderation. That's a word for the day. So everything in moderation, ladies and gentlemen. So that's what I would say about that, because again, there is the risk of enhancing whatever skin condition you may have in a negative way, or initiating or inciting a new skin condition that we don't really want. So everything in moderation as much as you can help it. Okay, things that we should incorporate into our skincare routine. So I think by and large, if you talk to most dermatologists, we're actually quite simple when it comes to skincare practices. I'll just say for myself, if we're talking moisturizers, I like 3 brands: Aquaphor, CeraVe, and Cetaphil, and that's kind of what I use as far as moisturizers are concerned. I use a sunscreen year-round, and my sunscreen of choice is Elta MD, ELTA MD. And then as far as face wash is concerned, my 3 brands: CeraVe, Cetaphil, and La Roche-Posay, and that's pretty much it. And I stick with those consistently. So I think the key is to find brands that work for you. If you have sensitive skin or have a history of eczema, you might want to consider those 3 brands that I mentioned because they tend to be very bland and don't have too many fragrances or other products that could, or additives that could irritate your skin. For patients that have their Mary Kay and their Sephora this and their Sephora that, if that works for you and it's not irritating your skin, then you stick with that. But for my acne prone, for my sensitive skin, for my eczema patients, by and large, the 3 plus the brands that I named are kind of what I like to stick with. And also my shameless plug for sunscreen. Get yourself a good sunscreen because, a lot of my patients that are black and brown that come into the office, the concern is discoloration. And I think one of the best ways to combat discoloration is to wear sunscreen and to prevent your skin from developing additional spots, particularly with women that are concerned about melasma or discoloration of the face. Sunscreen, sunscreen, sunscreen. You'll go to a million different dermatologists. They can all give you treatment to kind of help the discoloration. But if you're not doing the sunscreen on top of it on a regular basis, it really can eradicate any progress that you do make. So sunscreen is your friend, ladies. And as far as the skincare routine, I think the key is to wash your face, which I think we all know, and just have a good moisturizer and a good sunscreen. Beyond those things, I think the 2 other things I'll say is going to be having a great retinoid. I think retinoids are fantastic. They're good for fine lines, wrinkles, the aging, acne, discoloration secondary to acne, etc. So I love a good retinoid. You can get it over the counter. It's sold as retinol, RETINOL, and then or have a dermatologist prescribe you a tretinoin, a topical tretinoin cream that you would use nightly or every other night. It can definitely cause dryness and irritation, so it's something that you have to kind of build up to using regularly, but I think all the benefits that come with it are really a plus, and I think if you ask a lot of dermatologists, it's definitely something that we all love and probably use ourselves. So a good retinol is always a good thing to just consider. The last thing I'll say, just because thinking about family, friends, etc. over the past year, is vitamin D supplementation. So I know I've been saying no vitamin D or no supplementation, but hear me out. So I think a lot of people, especially with COVID and being indoors and working from home, have not been getting outside and getting that necessary sunlight that they need in order to make vitamin D. And so their vitamin D levels have been low. And the literature has been very clear in showing that low vitamin D, especially in someone that already has a skin condition or is developing a skin condition, can make it that much more difficult to treat a particular skin condition, such as alopecia areata is one that comes to mind. But I think in those cases, again, it's always a good idea to just get the vitamin D level checked. And if that's something that is low, and you can get that checked with your primary care, but if that's something that is low, you might consider vitamin D supplementation. And I think that's a good part of skincare, a daily skincare routine if you are found to be low. So I think if I'm going to say my top 5 for skincare routines, I would say water, exercise, good nutrition, a retinol if you're into that, which I am, and the last one is vitamin D supplementation if that's something that you find that you may need. So those would be my top 5. As far as products, I've told you mine, but find whatever works for you and kind of stick to it and just enjoy your particular product, because I definitely enjoy mine. Okay, so medical providers in dermatology. So this is a very interesting topic and an ongoing topic of conversation. And I don't think it's exclusive to dermatology. I think it's medicine in general. We have a growing generation of people that are aging. And so that's going to require a lot more hands on deck to attend to those medical needs. And so dermatology is a very small field of medicine. There are not a lot of us, and we are kind of in certain pockets within the country. So you'll find that certain places have a high density of dermatologists, like Florida, like California, like New York, and you'll find that places like the Midwest, by and large, don't have as many providers. And it's unfortunate because even the patients that live in Florida with a high density of dermatologists can find themselves waiting anywhere from 3 months to 6 months to 8 months before they're able to see a provider for a skin condition, that's difficult. That's difficult to say as a healthcare provider. It's difficult to hear on a regular basis from patients, because that's something that none of us, want to contribute to. I think that there are ongoing efforts to remedy this, and I think a large part of that is filling in the gap with mid-level practitioners. So nurse practitioners, physician assistants, individuals that can kind of fill in this gap where dermatologists as a field or dermatologists may be struggling to, just because it's such a small field and there's just not enough of us to get the job done in that capacity. So I think that's a huge effort right now, is having nurse practitioners and physician assistants who are trained to deal with your more rudimentary derm conditions, your acne, your eczema patients, things like that. And in some practices, even your skin checks, to just give a nice head to toe for a patient, a skin cancer screening. So there's a lot of studies and research going into that to make sure that regardless of the level of medical education, whether you're seeing a nurse practitioner or a physician assistant or a dermatologist, etc., that you're receiving the best care and how to best triage patients when they come through that door as a new patient to get the best care. whether that means they immediately need to go to the dermatologist because this is a particular condition that supersedes the nurse practitioner or the physician assistant's comfort level, or even if that means that exceeds the particular dermatologist's, understanding of the skin condition and making sure that they connect the patient with the appropriate person. So I think this is going to be really interesting over the next 10, 15 years, not just for dermatology, I think for the field of medicine as a whole. How do we fill in these gaps? Is it with mid-level providers? Or is it some other way? I'm not sure what the answers are, to be honest. I think a large part of why I went into dermatology is to fill this gap, is to stand in the gap, but I recognize that I can't do it alone, and I recognize that there are others like myself, but that we can't do it alone. So it's definitely a logistical issue and an ongoing issue, but I think we have a lot of bright people who are interested in providing the best care. And so I have no doubt that we'll find a happy medium, and that just like with everything, we'll continue to fine tune and adjust it as new things come up. But it definitely is in our medical literature. I just had, a presentation not too long ago with some of my colleagues at Wake Forest discussing this same topic. So I think it's definitely at the forefront of all of our minds as we think about what medicine of the future looks like. Okay, let's see. Oh, when to see a dermatologist. Yes. So I think that everyone should have a dermatologist. Just like everyone has, or mostly everyone has, a primary care physician, I feel like people should just have a dermatologist in their back pocket so that if and when something comes up, if it's a mole that they want to have checked, if it's a hair loss issue, if it's a skin discoloration issue, whatever issue arises, that they're able to be seen in a timely fashion. I think it's unfortunate that, again, the wait times are what they are in most derm practices. However, I think that by and large, if you are considered an established patient, which oftentimes I think is less than 3 years from when you were last seen. It varies from practice to practice, but I think by and large, it's if you've been seen within the last 3 to 5 years, you're an established patient. Then in that time frame, it's easier to get a follow-up appointment, and maybe someone will cancel, or I just think the time frame is a little bit shorter for a lot of those patients, as opposed to patients that are just trying to set something up all of a sudden, which is unfortunate and not a great thing. And again, we need to work on it as a field. But for where we are right now, I think it would behoove patients to just establish care with a dermatologist that they feel comfortable and confident with, because I think that's a huge thing. For myself, growing up in Central Florida, we were fortunate enough to go to dermatologists for acne, but I remember going to at least 2 or 3 different providers before finally feeling comfortable, before finally feeling heard, seen, understood, all of the above. And so I think it's important to kind of find someone that you truly feel like you can have a rapport with, and establishing care with them, not just for yourself, but maybe for your entire family. So again, if anything comes up, you can be seen in a timely fashion by a provider in that practice and get the care that you need. Also, shameless plug, I know that we as Black and brown patients do not develop skin cancers to the same extent as our peers. However, we do develop skin cancers, and when they come, they often come on the palms of our hands, or on our hands, I should say, in general, or on our nails, nail beds, our toenails, or on our feet. And so it's really important to know different from our peers to kind of have someone to regularly check our fingernails, our toenails, our hands, and our feet. Might not need to go every year or every 2 years, but if you notice that a little beauty mole or a little mole has been growing a little bit quicker than you've noticed, or that there's been any changes to it, then that's something that you want to bring up with your doctor, because as you can imagine, if you're not even aware that your mole is cancerous, you're not looking at it, you're not noticing it, especially if it's at the bottom of your foot or in your nail bed or, anything like that. If you're not paying attention to it, we're all human. It's going to grow, it's going to expand, and it's going to be that much more difficult to remove it, and also increase the chances that it may have spread and metastasized to other parts of the body. So, not to scare anyone, I hope that is not my intention, but I do hope that what people take from this is that establishing care with a dermatologist is important, and it's never a bad idea to maybe go see them for eczema or go see them for acne or melasma or whatever it may be. And also while you're there, hey doc, can you check out this mole? Can you check out this mole? Can you check out this mole? Have them take a look at your moles, particularly the ones on your hands and feet and your nail beds, to just make sure that everything is normal and perfectly fine. And that's our job as dermatologists, is to take a look at, patients' moles and kind of make that quick decision. Is this something that's harmful, or is this just a normal run-of-the-mill mole that this patient has? And so if we can bring comfort to patients in doing so, I think that's important. And one of my mentors, Dr. Michael Wangia in Orlando, Florida, he tries to make a point with all of his skin of color patients, black, brown, and otherwise, to do a good skin check, just to make sure, because by and large, we do not routinely look at those parts of our skin. And that's not a black or brown issue. That's just a person issue. People just do not look at their moles in those places. And so making sure that we're doing those kinds of skin checks, even if the person's just coming in for acne or something completely unrelated. We just want to make sure we're catching any skin cancers early enough, just like we do in all other patients. So that's my plug. I hope everyone can find a dermatologist that they love and that loves them, and that they can develop a great relationship with to get all of their skincare needs met. The last topic for tonight is going to be common medications that damage our skin or create an allergic reaction. So there are a few different topical agents that can do it. There are also some oral medications that can do it. So if we're talking about topicals, we definitely have patients that come in who have developed an allergy to Neosporin. There are plenty others that I won't go into tonight, but I think by and large for topical treatments, that anything that's, in a gel, a solution, a cream, an ointment, things like that, anything we're applying to our skin, there is the risk that we can develop an allergic reaction to. And that's whether it's something that we prescribe you as physicians, but also just topicals that you guys get over the counter, like a Neosporin. So I think they all pose that risk, but you have to weigh the risks with the benefits. So if it's medically necessary, you have to sit with that and sometimes even talk to your doctor about it as to whether this makes sense for you to use or not long term, or even in the short term. If you are having some sort of reaction to a particular topical, you might notice redness, burning, tenderness, itchiness, any of those things. You might even form a little bit of blistering in those areas. So just be mindful of those things. And again, seek medical care if you have any questions or concerns. But those are some of the things you can notice with an allergic reaction to a topical. As far as oral medications, there have been a few culprits, we'll say, a few oral medications that have been called into question and have instigated particular skin conditions and skin diseases, antibiotics, antihypertensive or blood pressure medications, anti-epileptics or anti-seizure medications, to name a few. Again, just like I mentioned for the topicals, you kind of have to weigh the risks and the benefits of that. Just because those medications have been implicated in skin disease does not mean that it's going to happen in your particular case. That being said, if it does happen and you do, take a particular antibiotic and you realize that this causes a particular drug reaction every time I take it, it causes a particular skin eruption to evolve, might want to add that to your list of medical allergies, and just make your primary care physician as well as the specialist in your life, like a dermatologist, aware of it. But again, just like I mentioned before, it's always important to weigh risks and benefits of short-term use versus long-term use, or just use in general of that particular treatment. I don't think we should be in fear of medications, topicals or otherwise, or over-the-counters or otherwise. But I think it's important to kind of just be of the mind that this has the potential to cause a side effect, cutaneous or otherwise. And so I need to ask those questions and make sure I'm making the best decision for myself and my family. So those are all of the questions for today, or topics for today, I should say. It was a pleasure participating with you guys. I hope that the rest of the presentations go fantastically. Again, if you have any questions, comments, or concerns, please reach out to Lakeisha, who will hopefully reach out to me so that I can answer any of those. I look forward to doing this presentation again in the future. And if I can say any parting words, I would say, please get a dermatologist. We love to see patients, and we just learn so much from our patients, especially our patients of color, and getting to see different skin conditions in skin of color makes a huge difference in, our understanding as dermatologists. We're one of the rare specialties that get to see everything in live color, and so different things present differently in different skin tones. And so show us all of your cool, interesting skin findings, because we love to see it and we love to treat it. So get yourself a great dermatologist. Continue to ask the questions so that we will continue to do the research and find the answers for you guys. Stay safe in these times. Stay healthy from a physical standpoint, but also a mental standpoint and spiritual standpoint. Drink your water, and like I mentioned before, if you're going to do a supplement, do vitamin D only if you have a low vitamin D count. No other supplements unless you have a deficiency of one of them in one capacity or another. And a retinol and a sunscreen, I don't think they ever hurt anybody. I'm not sure, but I don't think they've hurt too many people. But I will say that a sunscreen is a great idea. Find one that works for you. And a retinol, I mean, it's one of my faves. Between the sunscreen and the retinol, I think the sunscreen is my favorite. But I think both are great options to add to your skincare routine if you don't have them already. And drink your water. Enjoy Thanksgiving. Season's greetings to everyone, and y'all have a wonderful evening. Thank you.